Just a reminder before we get started with today's episode, I am on Instagram. So if you go to @Truth and Fertility Project, you can find me there on Instagram. Follow me. I put reels up of every single podcast episode and also just some learning reels here and there. Also, remember that all of these episodes are now on YouTube. So if you want to watch my face with the person that I'm interviewing, you are welcome to do that. You can find me on YouTube @Truth and Fertility Podcast. So go to YouTube, go to Instagram, subscribe, and follow me on all of those platforms. And I hope you enjoy today's episode. My cycles were getting longer, more abnormal hair growth, more acne, more of those symptoms, more extreme than I'd ever experienced, was when we were like, okay, yeah, now might be the time. As much as I was able to maintain my symptoms and help my symptoms and help my body really ovulate well by eating healthy, by exercising regularly, there was still just this gut feeling of, I need to do something more. This is when my husband and I started discerning, okay, maybe it is time. Welcome back to the Truth and Fertility Podcast. I'm Haley Yeager. Today I am solo. Normally I'm not solo, but I just got surgery. I just got an ovarian wedge resection and I had so many questions about it. And I know that I myself, if I am super intrigued or interested in something, I know a lot of my listeners are too. And so basically what I want to do today is kind of outline exactly what happened, why I even went for the surgery in the first place, because not everybody is needing a surgery when it comes to PCOS. So I just wanted to go through, the update on why I got that surgery, how the surgery went. I just also had my post-op appointment with my surgeon. And so that was totally interesting. And she walked me through the whole video of the surgery. And some people might get a little ick about that, but I just thought that was so interesting. And the whole time I was watching it, I'm like, there are hundreds of women that I know would love to sit in this room and get this play-by-play of what actually she did, what actually my surgeon did. So yeah, that's going to be the purpose of this episode today, is just to walk you through all of those things. Now, if you are new to the podcast or new to Truth and Fertility in general, I want to give you just kind of a brief story of what I have gone through in the past with PCOS. So yes, I have PCOS, and just to give you kind of that quick background, for returning listeners, you probably have already heard, I think actually my first ever episode on the Truth and Fertility Podcast was me going in deep dive into my previous just diagnosis and then what I did for treatment. I now have 3 beautiful children because of doing treatment when I was young. And before I even had a husband, before I was even thinking about having children. And so that was just such a huge blessing. So the whole deep, detailed story is I think it's genuinely episode number 1. So you're welcome to go back and listen to that. But just a quick kind of overview of what my experience has been. So at 16 years old, I noticed that I had irregular cycles. From the time I had my period, they never were ever regular. And by 16, I'm like, you know what? This is kind of weird. Most of my friends have regulated. Let's just go check this out. And then so I went to the doctor. What happens when a 16-year-old girl goes to the doctor, says she has irregular periods, she gets put on the birth control pill, and that's exactly what happened. So I took the pill for only about 2 months, and it made me super moody. Horrible side effects on it. I didn't feel the same on it. And so I was just like, you know what? Having these irregular cycles is way better than feeling like this. So I got off of it after 2 months. So very brief experience on hormonal birth control, the pill specifically. And then I just never really did anything more about it until I was 18 years old. At this point, I was learning more about natural family planning. I was learning about just what it means to chart your cycle. And there was a specific talk that was given at my youth group at church when I was a senior in high school. And she talked about the Catholic Church's teaching on hormonal birth control, on natural family planning. But she also, praise be to God, mentioned that by charting a woman's cycle, that can actually be helpful in medicine for doctors that are trained in reading those charts and actually diagnosing and treating women based on what her fertility chart looks like. So this kind of light bulb went off in my head. And I realized, okay, there's another option here. So I went back to, I don't think it was the same doctor that had originally put me on birth control, but I just went back to like a mainstream doctor and said, okay, I'm here. I'm still having these irregular periods. Nothing has changed. She very kindly asked me, why don't you want birth control? And I said, well, and this is what I knew at the time, probably because of that talk I sat in. I just knew, okay, I am not ovulating regularly, which is why I'm not having a period regularly. And the birth control pill doesn't help me do that because it's the first mode of action is that it suppresses ovulation. So I said, that's why I don't want it. And she asked me, which it could have been anyone. It could have been any mainstream doctor that would have asked me this, because this is the general idea of what's the purpose of ovulation. She said, why do you want to ovulate? And it was at that moment that I realized, okay, we're speaking two different languages, because ovulation is like, it is so, it is a regular woman's bodily function. Like, it is very natural and normal and should be happening regularly. And so when that's wrong, when that's not happening, that's a sign there's something wrong. That's a sign that there's an issue. I realized I was going to tell you the short version, and I'm getting into the long version. So if you've heard all of this story, feel free to skip ahead a couple minutes. But anyhow, I was like, okay, this is not going to work. I ended up going to a different clinic. I'm from Phoenix, Arizona. There's a pro-life clinic out here that practices restorative reproductive medicine. I started going to them. And again, I'm 18 years old. I'm not married. I'm not experiencing infertility. I'm not trying to have kids. It is just, I want to regulate my cycles. And they immediately, birth control pill wasn't even offered. That wasn't even in question. They had me start charting my cycle, specifically with the Creighton method, because Creighton ties specifically with NaProTechnology, which is a form of a women's health science that really treats the root of whatever you're going through and really healing it from the ground up. So this clinic specifically specialized in that. So they had me start charting my cycle. They did some blood work. They did an ultrasound. That's how I received the diagnosis of PCOS at 18 years old. So it took me a couple years to really find what actually would work. So I tried, some medications. I think I got like on the highest dose of metformin, which is a pretty common medication for women to take when they have PCOS. Some women respond really well to that. Other women don't. And I was one that didn't. So that wasn't really working for me. What worked and what moved the needle was diet, specifically low carbs, low sugar, high protein. And really just eating well. I mean, I was also a college student at this point, so anything was probably better than what I was putting in my body at that point, food-wise. And so I really saw, I think it was my sophomore year of college is when I really started to, maybe it was junior year. It was right around the time that I ended up meeting my husband, and I was 20 years old when we met. So I really started changing my diet, and that's what moved the needle. Now, I will say that I never have ever gotten to a point where I had a regular cycle in that I was ovulating every month. Gold standard cycle is like 28 days because that's 4 full weeks. And so I've never had anywhere resembling that. I think my shortest cycle I've ever genuinely ever had was like 40 days. That's my shortest. My regular, my norm is anywhere between 50 to like 75 full days. So like that's from first day of one period to the first day of the next period. And so even though my cycle wasn't regular in that it wasn't occurring every month, I was still ovulating. Like I was ovulating, and that was a huge win in and of itself that I was ovulating. And so around this time, I meet my husband at 20 years old. I got married when I was 21. And we wanted to have babies right away. And it took about 7 months to conceive my firstborn, who is now 6, which is insane. So it took, a couple months to conceive him, but ultimately we did. And I owe all of that to the grace that I got by God to tackle this early. So this is like why I'm so passionate about teaching high school women, college women, young adult women, like focus on this now. If your body is telling you something that it is telling you that something's wrong, listen to it. Learn how to read your body. We literally call this now body literacy, like learning how to read your body, learning how to know when it's telling you something is off, either hormonally or anything, right? So really being in tune with your body, you deserve to do that at a young age. And so just because of my story, like hands down, my husband and I, if I hadn't done the work that I did at 18, 19, 20 years old, we would have had a story of infertility. I mean, it would have happened. I assume, of course, but I think it's safe to assume that we would have. And so I got to a point where I was ovulating regularly. Now, here's kind of where we get to where we're at now. So I've always known in the back of my mind that there's this surgery called the Ovarian Wedge Resection, and it's specifically to help women with PCOS. The end goal really being putting it in remission. That's the hope. And so I've always known in the back of my head that surgery was there. But I think, we conceived my son. He was born like right before COVID happened. And then I nursed him for a year, didn't have my cycle at all. And then when my cycle did return, it took maybe a month to conceive my daughter, so that my second born. So it was like, okay, here we go. Things are looking good. Everything's fine here. So they're about 2 years apart. And then after my middle child, so I have 3 kids. After my middle child was born, I nursed her for about a year. I typically don't get my cycle back till I'm completely done nursing. I know I'm one of those lucky women that don't. I know other women have a different story about that. But I stopped nursing her. My cycle came back, and then it took almost the same amount of time that it took to conceive my son that it did to conceive my now almost 2-year-old. So my third baby. So it took a little bit of time in between to actually conceive her again. Now, what's really funny is that, and just kind of ironic in the way that the Lord works in your life, is that this surgery is always in the back of my head. And so I had my son, I had my first daughter, and then it takes a little bit of time to have my third child, which is my second daughter. And so in that time, my husband and I started to think about, okay, maybe the surgery is in our future if I still am really struggling. Because also, again, this whole time, my cycle is still long. Like I'm still having on average about a 65 day cycle. But I can still, because I chart my cycle, you guys, because I chart my cycle, I still know when I ovulate. And I owe my children to that. Because even though I don't ovulate once a month, it's once every 2 to 3 months, I still know when I ovulate. And that is why my children are around today. Again, so grateful, but without jumping on another soapbox. So my husband and I started thinking after my second child, okay, maybe the surgery is something to think about. At this point, too, we now had a surgeon just literally like down the road, Dr. Erica Kreller. I've interviewed her on this podcast. She was my surgeon. She also delivered my third baby. So I know her. I know her well. I trust her with everything. She's phenomenal. And so I knew who the surgeon would be. I started feeling more comfortable with the idea. Now, what's funny is that I had an appointment with her scheduled. This is before my third. So I had 2 kids. I had an appointment with her scheduled, and my husband and I were discerning, like, okay, is this surgery something that we're going to do? And we had decided, yeah, we're going to do it. We're going to get on her surgery schedule and just kind of see what happens. The appointment that I had with her, where I was going to tell her, I want to be put on your surgery schedule, I found out I was pregnant with my with my third baby. And to be quite honest with you, again, because I chart my cycle, I had an inkling that I probably was pregnant, but I hadn't taken a pregnancy test or anything because, quite frankly, I didn't have any like in my cabinet, and I didn't want to go buy one. And I just figured, I'll just find out at this at this appointment if I'm pregnant or not. And so that's exactly what happened. So I kind of had an inkling already. I had for those of you that know the charting terms, I was on like post peak. So peak is around the time that you ovulate. I was post peak like 18 days. And typically you would have about like a 14-day post ovulation phase before you got your next period. And when you get to the point where you have like 15, 16, 17, 18, like I think from what I've learned is that when you hit 18 days post peak and you've tried to achieve pregnancy, it is pretty darn accurate that you are probably pregnant. So anyhow, I get to this appointment and it turns out I have a positive pregnancy test. Praise be to God. And so I feel like that was the Lord just being like, now's not the time, Haley, now is not the time. So that happened. And so I just I forgot about it. I just forgot about the surgery. Clearly it was not the time. I had a regular pregnancy, delivery. Now I have my third baby. And so what's interesting though, is that with every kid that I had, I realized that my PCOS symptoms, so typical symptoms, there's so many symptoms that you could have that could point to PCOS, but some of the main ones that I personally experience are obviously the irregular cycles, like hair growth, like you guys, I gotta pluck my face every once in a while. Like, we're just gonna put that out there. That's just what we're doing here these days. And so that is a huge symptom of PCOS because you have high testosterone, and and like acne and things like that. Those are pretty common symptoms of PCOS. So I noticed that after every baby, those symptoms were getting more. The symptoms were getting worse. Like they were getting more heightened. And so this time around, my daughter, my youngest, is now almost 2. And this was months ago. This was probably so right now we're in May. I think this is going to be released in June of 2026. I'm trying to get my timeline right. Probably just back in the fall of 2025 is when my husband and I started really seriously thinking more about the surgery, because as my symptoms were getting worse and my cycles were getting longer, I ended up having a 104-day cycle. And then I had like a 107-day cycle. I mean, like my cycles were getting longer, more abnormal hair growth, more acne, more of those symptoms that like more extreme than I'd ever experienced, was when we were like, okay, yeah, now might be the time. Because as much as I was able to maintain my symptoms and help my symptoms and help my body really ovulate well by eating healthy, by exercising regularly, I do admit that I probably could still be eating healthier. Like there is, yeah, there is still, I will admit that. But there was still just this gut feeling of, I need to do something more. So this is when my husband and I started discerning, okay, maybe it is time. So, and again, I think it was more easy for me because I knew the surgeon. I knew the surgery. I worked at this clinic where I was teaching women how to chart their cycles with the Creighton method so that they can work with this specific surgeon and get get a surgery with her. And so for me, I think I had so much trust in A, my surgeon, B, the surgery itself, because I had seen firsthand how it was helping women. Most of the women that I worked with when I was at this clinic, I mean, at least half of them were struggling with infertility. That's why they were there. And most of them, I would say, after they had this surgery, achieved pregnancy like within the first couple cycles. Like I saw it happen like in front of me. And so I think because of that, I really had a really privileged understanding of what the surgery is who my surgeon would even be. And I recognize that that's not most women's experience. It just so happened that it just happened that way. So now this surgeon, as all surgeons that are NaProTechnology trained, that do these very specific surgeries that are very, their expertise is just more than any surgeon that could specialize in anything like this. They are highly sought after. So it wasn't just a, hey, let's do surgery next month. It was, hey, let me get on your surgery schedule and we'll do it in like 8 months. So I had gotten on her. Actually, I don't think it was that long of a wait. For some women it is though, and with other surgeons and depending on situation. But I had gotten on her surgery schedule sometime over the winter of 2025, maybe early 2026. And just had my surgery in May. Now, so that's kind of the rationale that I used and my husband and I used together to make this decision to get the surgery. So now I kind of want to walk through with you, like, what even is this surgery? What does it do? And my experience with it. Because I think, as I mentioned at the beginning, I got to walk through. So in my post-op appointment, she took a video of the whole surgery and walked me through, like, scene by scene, what she was doing. I just thought that was so interesting. It was so cool to be able to see that. So what happens is it's a laparoscopy. So it's very small incisions, but there was 5 total incisions just across my abdomen, and it's robotic. So she's like sitting behind a robot doing all this, which I also just find so incredible. Also, find that incredible. And so the first thing that she did was the ovarian wedge resection. Now, what happens there is typically with PCOS, the ovaries are enlarged, and it's because they have so many undeveloped follicles. So kind of what's going on with PCOS, and the reason why many women have irregular cycles with it, is because every single cycle, there's a couple follicles that are chosen to start maturing. And there's eggs within these follicles. The follicle is kind of like the house of the egg. And so these follicles start maturing around the egg, but typically there's one that becomes dominant, and that's the one that's actually ovulated. And so that one would ovulate, that egg would release, and the rest is history anyhow. So then you would have ovulation. So what can happen with PCOS is you have a couple that are recruited, but none of them ever become dominant. None of them ever become to the point where you can actually ovulate. And so that's what was going on with me. And then every time it couldn't get over that hump, my body would just decide, okay, let's recruit a few more and let's see if we can do it with these ones. And then, okay, that didn't work. Okay, let's recruit a few more. So you have so many underdeveloped follicles within your ovary, and that can cause it to be enlarged. That's why it's called polycystic ovarian syndrome. You have polycysts, you have multiple cysts, those follicles. And so, so that can cause enlargement of the ovaries. And so even just looking at the surgical, like the video that she showed me, it was very clear that my ovaries were very enlarged. And so, with the ovarian wedge resection, as I said earlier, she cuts out a wedge of my ovary. And it was a pretty significant size wedge. I was surprised by the amount that she took out. And I made a comment about that too. And she was like, honestly, general practice, you would take out more than you would. More so, she said it looks more than it actually was. But when she closes the ovaries back together, you don't want it to still accidentally be enlarged. Like, you want to make sure that it's proper size when it's enclosed back together. So she took out a pretty big chunk of my ovary and then stitched it back together. Now, something about this surgery is that, I actually just did a podcast with Dr. Erica Kreller specifically on the surgery. So if you want to, I'll link that in the show notes below if you want really a deep dive with the surgeon herself about what is going on with the surgery. You're welcome to go watch that episode. But so she takes out that wedge, she sews it back together in a very specific way. And that's kind of where the surgery is, specifically a NaProTechnology surgery. The way that she stitches up the ovaries is supposed to significantly reduce the amount of adhesions that are possible from the healing process, so on and so forth. So there's a very specific way she does that. So that's the ovarian wedge resection. So she shut those, or she cut my ovaries and then shut them back up. And she did them to both. But then 50% of PCOS patients also will have endometriosis. Now, what's interesting is that I don't typically have painful periods, and that's one of the biggest symptoms, I would say, of endometriosis is that you have painful periods. And the reason for that, for those of you that aren't really familiar with what endometriosis is that, so on your uterus, right, you have a uterine lining. You have a lining of blood cells and tissue that is thickened every single cycle on the inside wall of the uterus. And so as this thickens throughout your cycle, when you have your period, that uterine lining will shed off the uterine wall, and that's the bleeding that you see. So the bleeding you see when you're on your period is your endometrium. It's the uterine wall. And so what's happening with endometriosis is that if those cells, those endometrial cells grow on the inside of the uterus, that's great. That's exactly what should be happening. But with endometriosis, what's happening is those endometrial cells, or cells that are very similar to those endometrial cells, start growing outside of the uterus. So sometimes they're on top of the uterus, sometimes they're on top of the ovary, sometimes they're even on top of the bowel. They're where they shouldn't be. And so when you are on your period, your hormones are dropping. Those estrogen and progesterone hormones are dropping, and that's what is causing that sloughing of the uterine lining. Well, all of the endometrial cells respond to that drop in hormone. So the uterine, like those endometrial cells that are the uterine lining within the uterus on the uterine walls, that sloughs off and that just comes out of the vaginal canal. That's your period. But the cells, those endometrial-like cells that are growing on the outside of the uterus, those still shed, but they have nowhere to go. And so that can be incredibly painful. And so that's why one of the first symptoms that really any doctor is going to look for when they're suspecting endometriosis is, do you have pain? Now, that's not to say if you don't have pain, you don't have endometriosis, but that's that. So she actually told me before surgery, simply because I don't usually have pain during my period, and I don't struggle with infertility. She said, because of those two reasons, I don't think you have endometriosis, but that doesn't mean that you don't. And if you do, she said she was going to take it out right then and there. And so that's actually what happened. I did end up having some endometriosis. Now, it was very minor. There's different stages that endometriosis can grow. And so, she didn't give me like a specific stage number or anything, but she just said it was very minor, but she still excised all of it. Now, in couple episodes from now, I recently interviewed Anne-Marie Williams, and we talked about the American College of Obstetricians and Gynecologists, their guidelines for endometriosis diagnosis and treatment. And one thing that we talked about, so look out, it's not out yet, but look out for that episode. Just to kind of give you a sneak peek, one thing we talked about was some surgeons that are not NaProTechnology trained will just burn. They'll do an ablation on what they think is that endometriosis. But the way that she described it, I thought was so good, is that when you just burn it, you can think of it like an iceberg. You're only getting the tip of the iceberg. There's still so much more that you're not touching, and that can just start growing again. And so the rate of recurrence of endometriosis coming back after having that surgery with an ablation, with the burning of the endometriosis, it's not very successful because the rate of return is really high. However, my NaPro surgeon did, Dr. Erica Kreller, what she did, and what all NaProTechnology trained surgeons are going to do when they remove endometriosis is they are not going to burn it, but they are going to excise it. So I literally saw it in the video. It was so cool. I saw how one of the robotic hands would pull like the tissue or whatever, pull that out, and then she would just cut it with the other robotic hand that had a scalpel. And then if you're listening to this right now, it might actually be really helpful for you to go to YouTube because I'm making a lot of motions with my hands. So unless you're driving or something, you might want to go to YouTube because you'll kind of see my hands demonstrate this. But with one robotic hand, she kind of pulled the endometriosis away from the abdominal wall. And then with the other robotic hand, she cut it. And then she had that tissue in the hand of that robot, and she took that out. And that's how she was able to biopsy a lot of it too, to even confirm if it was endometriosis. Because one of the things that she did do is whenever she cut out, and and this is what she said, anything that even resembled endometriosis, she cut it out just to make sure. Now, there were 2 specific spots that did come back from the biopsy as, yes, this was absolutely endometriosis. There was one spot on my abdominal wall, and then there was another spot on top of my uterus. So those were both excised. And there were other spots too. I can't remember if that was for sure endometriosis or not, but she cut out a fair amount of what she thought was endometriosis. So yeah, so it's super important too, that with this surgery, like if this is ever something that is in your future, you need to pick your surgeon well. Like, it is not just any old surgeon that states that they can remove endometriosis. Like, you really have to find a good one. So she removed the endometriosis. I ended up having also some stuff going on inside of my uterus, some polyps and things like that. So for everything to be being said, I asked her, I'm like, are you surprised that I've been able to have children? Like, with all the things, with all the issues that was going on that you saw in the surgery, are you surprised that I was able to have children? And she didn't say like specifically, yeah, I'm super surprised, but more so what she said is that based on what she saw, she wouldn't have been surprised if I did struggle with infertility, if that makes sense. So it's not that she was surprised by what she saw being, wow, I can't believe this girl has ever had kids. But what she did say is that if she saw this on any, and I'm summarizing her words here, if she saw this on any other person's body, it would have been a fair assumption to say, yeah, this person is probably experiencing infertility or maybe frequent miscarriage. So on that topic, this is more for, so Jen Fulweiler, go find her podcast. It's the Jen Fulweiler Show. She's a Catholic speaker. She's actually a stand-up comic, which is amazing. And I just really love her rawness. So I listen to her podcast every single week. And one thing that she says is, for when she's talking like in specific Catholic terms, she calls it that she's talking to the Catholic ghetto. And I just think that's hilarious. So for my friends out there that are in the Catholic ghetto that would kind of get this, with all of this being said, and like the question of why have I not struggled with infertility, I was talking to a friend of mine recently, and she's a little bit older than me. Her daughter is, I think, 12, maybe 13 years old. I love her daughter. She's very, very mature. She's just wonderful, wonderful young woman. And so I was talking with my friend and her daughter we were talking about Our Lady of Lourdes, and which, for those of you not in the Catholic ghetto, is a Marian apparition. So as Catholics, we believe that Mary appears to different people throughout history to aid the church and give enlightenment and give just very grace-filled words to the people that need them most. And it doesn't happen very often, but the church does approve specific Marian apparitions, because it's not just anybody who says, Mary appeared to me, we're just going to take that. There's a lot of investigation that goes into confirming whether or not like a Marian apparition actually occurred. So Our Lady of Lourdes is a pretty well-known Marian apparition site. It's in Lourdes, France. And very long story short, and I really truly don't know the depths of the story. I know many of you will, but Our Lady, Mary, appeared to Saint Bernadette, who was just this little girl at the time. And what happened was there was there was no water, and then there was water. And there's this stream of water that I'm pretty sure, like, say, if I am totally butchering this, I'm sorry. Like, my super Catholic friends, you can correct me on all of this. But from what I remember is that Mary asked Saint Bernadette to start digging in the dirt. And as she was digging, she started to see water, and it was healing water that just like appeared from nowhere. And now people from all over the world will go to the site where Bernadette and where Mary met Bernadette, and this healing font of water started to just appear. And there are a lot of stories of people being dunked in this water and major healings occurring. And so the reason I bring this up is because I was talking to my friend about different, I think what were we talking about? We were talking about Rome, and my husband and I, when we got married, we went to Rome, for our honeymoon, we went to Rome. And then we also went to Our Lady of Lourdes. That was another stop in Europe that we did on our honeymoon. It was really amazing. And when I went to Lourdes, I had known, okay, there's healing water at Lourdes. There's like, from what I've been told, there's like a mountain of wheelchairs and crutches, and that people just leave because they leave completely healed and they don't need those aids anymore, and they leave them there. And it's miraculous and it's beautiful. And so I was telling my friend about, our experience at Lourdes. And one thing that I haven't really said a whole lot on the podcast, or really told a whole lot of people, is that back in November, so this is November 2025, I had a back surgery. I have chronic back issues. I've had them since I was like 14, 15 years old. And this is actually my second back surgery that I've ever had. And so when I went to Lourdes, this was back in 2018, we went to Our Lady of Lourdes. And that was really the intention I was bringing there, was for my back, to heal my back. And, when you ask the Lord for a grace for something specific, you truly don't know if he's going to answer that specific request or not. And that requires faith and trust to even ask the question, and then faith to know that the way that question is answered might be in the way that you expect, but it might not. And probably what you would have put together already is that, no, my back wasn't, at least at that moment, like the moment I was dunked in that water at Lourdes, my back wasn't immediately healed, right? I did just have another back surgery a couple months ago. And so I didn't really have any huge conundrum about that. I was just like, okay, the Lord works in mysterious ways that I don't understand, and I don't try to attempt to understand it either. Maybe I do, and I fail every time. So I just, you kind of just have to leave it up to him. And so I keep going back to, so I was talking to my friend and my friend's daughter about all of this, and my friend's daughter brought up this point that really struck me. And I don't know why I didn't ever think of this, but 13-year-old girls can speak to your heart in ways that you don't always understand, and or wouldn't have expected, I should say. And she said, well, maybe the water from Lourdes is what allowed you to have your children. Now, I don't know. I don't know. There is no way for me to know if that is true or not. But she said that, and I just was like, man, first of all, why have I never thought of that before? Second of all, like, even though the water in Lourdes didn't shrink my ovaries, even though the water in Lourdes didn't completely eradicate my endometriosis without that surgical help, I still have these 3 children, and it just makes you wonder. It just makes you wonder. So I'm not sitting here saying that's why, but I think it's an interesting thing to think about, and how the Lord, when you ask to be healed, he will heal you. Like, he is the divine physician. He will heal you, and it will never be in ways that you expect. Or probably, I mean, maybe not never, but it probably won't be in ways that you expect. And for whatever reason, I have these 3 amazing children that I don't know if I probably shouldn't have had, given what the surgeon saw in the surgery. Maybe I'm being over dramatic about it, but it just makes you wonder. It really just makes you wonder that I am all about faith and reason. I am all about, you can logically think your way into faith. I mean, you shouldn't believe something if it's not true. And you should question everything that you think may not be true, because if it's not true, there's no point in believing it. And so you should question your religious beliefs, because if it's true, it'll stand up to your questioning. And so I'm all 100% about that. But that doesn't mean that we as humans are all knowing. It doesn't mean that we now have the power to do anything. There are still, it extends further than that. And so it just makes you wonder, did those waters and lords, do I owe my children's existence to that? You just never know. So maybe there's some of you out there, maybe one of you out there, that has been thinking about going to Lourdes. I'd say go. I'd say you might not know what's going to happen. The fruit of what does happen, you may not experience for 10 years down the road, but I'd say go. You should probably make that a priority, or even just, if the Lord is inviting you to be healed in any way or form that looks like, I would take him up on his invitation. I would take him up on it. And it might be painful as you go through the healing process, but it requires a lot of trust. And the people that I know who have an intense trust in the Lord, they are very joyful. And there's something different about them. And that is the type of person that I am not, but I aspire to be. So I am going to leave it at that. I am going to leave it at the wisdom of a 13-year-old. Maybe I don't know if she's 12 or 13, but I'm going to leave it at the wisdom of a preteen to say, maybe the Lord actually healed you, but it wasn't in a way that you expected. And faith and reason still completely go hand in hand, but there are still things that, because we are not all knowing as humans, we are limited in our understanding of things. There is still a depth to which we can never fully get to the bottom of until we are completely in union with Christ in heaven. And I have a list of questions that I'm going to ask him when, God willing, I'm up there one day. So anyhow, that is the story of the surgery. Recovery has been going well. It was a lot better and faster than my back surgery was. So recovery is going well. And my hope is to have regular cycles. Like, that is the hope. I don't know what the future holds. I don't know what will end up happening. 75 to 90% of women who have this surgery with irregular cycles beforehand, 75 to 90% end up getting regular cycles after. But that also means 10 to 25% don't. So I really this is another lesson for me in leaving it up to, okay, whatever happens, we will tackle it when we get there. But yeah, that is the story of my surgery and and how God's hand has been in the whole thing. And not everybody is going to need the surgery. I want to make that clear too, that doesn't necessarily mean that anybody who has PCOS must have the surgery. That's not at all. And honestly, it has been over a decade since I got my diagnosis to actually getting a surgery. So it's not, it's not always, it's not for everyone. And then even at that, it's not necessarily maybe it shouldn't be the first thing that you do, because it is the most invasive option, clearly. But that is the story. That's why I chose to get the surgery. That is what the surgery was. And I think you should take Jesus up on his invitation to heal you. So that is what I have for you today on the Truth and Fertility podcast. And I will talk to you guys again next week.